Hi there, welcome back to the Medigap show where we uncover the mysteries and the mayhem of our Medicare system and help guide you on the right path. So today's hot topic is, what are the 3 top Medigap plans? 3. So there's a lot of choices, there's a lot of information, there's always a lot of confusion that goes along with Medicare, especially if you're new to Medicare. Even if you've been on it for a while, it can still be incredibly confusing. So the easiest way to begin this conversation is to explain that there are only 2 ways to be on Medicare. 1, 2. Only 2 ways, no more than that. You can either keep original Medicare as your main coverage, as your main health care once you begin on Medicare. What does that mean? It means that anything your doctor deems medically necessary for you will be paid at 80% by our National Medicare Fund. Your provider will bill Medicare directly. Medicare will approve it and pay 80%. It could be something as simple as an MRI, all the way up to a heart transplant. If your doctor deems it medically necessary, original Medicare must pay for it at 80%. Now, a Medigap plan fills in the 20% balance. Not all Medigap plans pay all of the deductibles of original Medicare, but Plan F, for example, if you were born prior to 1955, you are eligible for Plan F. If you were born after 1955, you are not eligible for Plan F. So keep watching and I will tell you what the other letters are that you are eligible for. But if you were born prior to 1955, you can still enroll in a Plan F and it will pay the 20% after original Medicare pays the first 80%. It will pay all deductibles of your Part A, which is your hospitalization, and it will pay all deductibles in your Part B, which is your outpatient or medical side of Medicare. So that's Plan F. Plan G, that's the next letter. Plan G is the second best supplement there possibly is in the whole country. So what does that mean? A Plan G follows in line. It pays the 20% after original Medicare pays. So if you, again, anything from an MRI to a heart transplant, original Medicare will pay the first 80%. And your Plan G will also pay all deductibles in a hospitalization or an inpatient service. Plan G will pay the 20%, so you have a full 100% coverage in anything under Part A inpatient. Then Plan G will also pay the 20% balance left over after original Medicare pays the first 80% for all of your outpatient medical services. So things such as outpatient surgeries, chemotherapy treatments, all testing, anything that is durable medical equipment. Original Medicare will pay 80%, and then your Plan G or your Plan F will pay the balance, the 20%. The only difference there is that Plan G will not pay the $226 annual once-a-year deductible of Part B, which is your outpatient services. So if you're on Plan F, you can have it if you're born prior to 1955. If you are born after 1955, then you can choose a Plan G, and that Plan G will only leave you with an out-of-pocket cost of $226 for the year. All of your services will be covered. Nothing will be denied as long as your doctor has ordered it medically necessary. Plan N, which is the third one, is a little more complicated. It still pays your 20% of any inpatient hospitalization or anything covered under Part A that's considered all inpatient. Plan N is going to pay 100% of all of those bills. And then Plan N will continue to pay the 20% of your Part B, all of your outpatient medical expenses, after original Medicare pays the first 80%. With a Plan N, you are susceptible or subject to a $20 copay, up to a $20 copay in a doctor's office, and up to a $50 admission copay at I'm sorry, not non-admission copay in an emergency room. So $50 copayment for emergency room if you're not admitted. Okay, so Plan N is, let's break that down. So again, this is one option, one way to be on Medicare, and what I'm giving you are the top 3 Medigap choices that I would recommend to anyone. That's letter F, if you're born prior to 1955, letter G, if you're born prior to 1955 or after, you can have that one as long as you're over 65 in most states, or Plan N. Plan N is the most affordable monthly, but you may have a $20 copay when you visit your doctor. So how often do you visit your doctor? Do you go frequently? Then you might want to step up to the Plan G, which is going to run you a little bit more a month. And if you were born prior to 1955, you are eligible for that Plan F, which will pay all of your bills. So again, one way to be on Medicare, which is the most solid way, using original Medicare with a Plan F, a Plan G, or a Plan N. Those are your top 3 Medigap letters that you're looking for. F, G, or N. If you're too young for F, you go to G. If you decide that you don't really need G because G might cost $30 more a month and N is fine because you don't frequent your doctor's office very often, then go with Plan N. Okay, that's one way to be on Medicare. Those are your top 3 Medigap letters and plans. It's very simple. The complication of it is that there are multiple companies in almost every county in the whole United States that offer a Plan F, a Plan G, or a Plan N. But guess what? It doesn't matter, because when you go to a doctor's office or if you go into a hospital, and if you have a Plan F, a Plan G, or a Plan N, they could care less what insurance company name is written on your Plan F, Plan G, or Plan N card. They could care less. It could literally say Dunkin' Donuts on the card, because they will be billing original Medicare, your red, white, and blue Medicare. So just keep that in mind. All Plan Fs are standardized by the federal government, which means they're all the same. All Plan Gs are standardized by the federal government, which means they're all the same. And Plan N, every Plan N is also standardized by the federal government and all the same. So again, does not matter what name is on that supplement or Medigap card. The secondary, the Plan F, if it has it's a letter. Boils down to a letter, whether it's a Plan F, a Plan G, or a Plan N. Those are the top 3 Medigap plans in the United States, and best coverage you could possibly have. Now, the other option, the other way to be on Medicare is what's called Medicare Advantage. It is a complete takeover, replacement, substitute, whatever word you want to use, for original Medicare. Which means you cannot have a Medicare Advantage plan and have a Medigap plan at the same time, because literally a Medicare Advantage plan replaces your original Medicare. Bye-bye, original Medicare. You're stuck on Advantage for the rest of your lifetime many times if you have any health issues. So just beware, Advantage plans are highly advertised, highly marketed. They're $0 premiums per month. They work well if you have a lower income, because you do receive extra benefits from the federal government, from private insurance companies, but most Americans, the out-of-pocket cost is incredibly high this year on an Advantage plan. Number one, it replaces your original Medicare, which means that if your doctor orders something medically necessary for you, you may not be able to get the treatment if you're on a Medicare Advantage plan, because it has replaced original federal Medicare and all of its laws, rules, and regulations with a private insurance company who then makes that final decision as to approve or deny a claim, or approve or deny a prior authorization and treatment for you, even if your doctor said that it was medically necessary. And Medicare Advantage plans, again, this year, in the big ones, the big PPO plans that are out there, they are $0 per month, which makes them incredibly attractive. They do also give you free dental most times and free vision. But unless you qualify for low income or Medicaid, if you're on one of these PPO plans, your max out of pocket in network this year is $8,300. That's in network. out of network is over $11,000. The HMOs are so incredibly limiting. They do have a lower max out of pocket this year, $3,900, $2,900 in some markets, depends on your county, but incredibly limiting with very small pool of doctors and hospitals to choose from. HMOs, you do have a gatekeeper. So to just sum it up for you, there are two options to be on for Medicare only. Two options: keeping original Medicare, and then you enroll in a Medigap, also known as Medicare Supplement, Plan F, Plan G, or Plan N, or you choose the other Medicare Advantage plan, which completely replaces, this is original Medicare, it replaces it. No more original Medicare. You've given up your original Medicare rights to a for-profit insurance company. Anyway, it's a lot to take in. It can be very confusing, but just know there's only two options. You can either keep original Medicare and enroll in a Medigap plan when you first start on Medicare, or if you're healthy, you can make a switch during annual enrollment period, October 15th through December 7th, also again in January, from January 1 to March 31st, or you can go on a Medicare Advantage plan and be on it. And hopefully never, ever, ever, ever have to use it because they're not that easy to use. All right, enough. I'll get off my rant for the day. You'll have a wonderful Easter. I'll talk to you soon. Bye-bye.